Data for the upcoming Medicare year for 2025 has recently been published, and I've spent a lot of time sifting through this data to hopefully make it easier for you. And I've uncovered a potential surprise that specifically centers around Medicare Part B for those who are married that you may want to pay attention to. But first, let's discuss what original Medicare actually is. And if you don't know, that comprises of Part A and Part B. So the things that Part A covers are inpatient hospital care, critical access hospitals, skilled nursing, home health care, and hospice. While Part B covers services such as clinical research, physician services, ambulance services, mental health care and substance abuse disorders, and durable medical equipment, otherwise known as DME. That said, I've stated in another video that looks or will look like this once released on the channel. The largest changes will be seen in the cost spikes for Part B premiums and deductibles, but also Part A's deductible as well. Now, for most Americans, meaning 99% of people, you will not have to pay a Part A premium assuming that you've worked 40 quarters, which is 10 years. However, you will see a difference in the inpatient hospital deductible, which is now $1,676 for 2025. This is a $44 increase from 2024. Now, keep in mind that this deductible for Part A is not an annual deductible. Instead, it's known as a benefit period deductible, which means it begins when you're admitted into the hospital for an inpatient stay, or if you're admitted into a skilled nursing facility. Then it ends when you haven't received any inpatient hospital or skilled nursing care for a consecutive 60 days. So, say for example that you have to go into the hospital in January and then again in June, you would have to pay this deductible twice in the same year. For Part B's deductible though, this is an annual deductible, which is now $257 for 2025. Which is up from $240 in 2024. And again, this is paid annually, so once per year, and it does reset each year. If you finish paying this off in September, by January, it will reset and probably will be a little bit higher. But another change to Part B comes in the form of its base premium, which has increased from $174.70 in 2024 to $185 in 2025, which is a $10.30 increase over the last year. Now, if you don't know, the changes made here are determined by the provisions seen inside of the Social Security Act, which in simpler terms means the Social Security Act has specific guidelines and calculations that determine how much you'll pay for Part B premiums, deductibles, and coinsurance and or copays. Then something to take note of in regards to Part B is that individuals whose full Medicare coverage ended 36 months after a kidney transplant that do not have other types of insurance coverage at the moment can elect to continue their coverage of immunosuppressive drugs if you are willing to pay the premium for it, which in 2025, that premium will be $110.40. Also, since 2007, an individual beneficiary's premium has been determined by their income. And these adjustment amounts roughly affect 8% of people with Medicare Part B. So if you are a high income earner with full Medicare Part B coverage, your premium could be at least $74 higher than the base premium if you make more than $106,000 annually and you file single, or if you make more than $212,000 and you're filing jointly. And this premium rate adjustment based on your income is known as the Income Related Monthly Adjustment Amount, otherwise known as IRMA. And this is why Part B's premium is known as a base premium. Now, for those who have Part B with immunosuppressive drug coverage only, meaning people with kidney transplants who need to keep taking immunosuppressive drugs to prevent organ rejection. Again, you can expect to see a premium amount of $110.40. And that's if your income level is $106,000 or lower, filing single, or $212,000 or lower, filing jointly, which is a $6.60 increase over 2024, which is a 6.2% difference over the past year. However, if your income is greater than $106,000 filing single or $212,000 filing jointly, and you are using immunosuppressive drug coverage, you could expect possibly to see $73.60 or more in your premium amount. Now, here comes that wild card, at least in my opinion here, because this comes in the form of premium amounts for those who are married living in the same house or household and filing separately. Instead of your income needing to be $212,000 from before, it only has to be at or under $106,000 per year, which would mean that you would pay $185 per month, which is up from $174.50 from 2024. But if your income falls between $106,000 and $394,000 per year, you could expect to see a $406.90 increase, which is added on top of that $185 amount that I talked about before, bringing your total premium to $591.90. Again, if you fall in that income bracket. If you're higher than $394,000, you could expect to see an additional $443.90 on top of the $185. This does roll over to those who are enrolled in Part B and using only immunosuppressive drug coverage only, because the same income thresholds apply here. However, instead of the $185 per month, you'll pay $110.40 per month. And this again is for 2025. And if your income is over $106,000 per year, again, living with your spouse, filing separately, you will potentially see a $404.90 increase on top of the base amount for 2025. All right, so I've talked a lot about the Part B coverage, and there's a lot that goes into that inside of the coverages and the changes that have been made for 2025. But I also need to circle back and talk about Part A again and actually talk through Part D as well to get a more holistic view of the coverage. So as stated earlier, Part A's deductible for 2025 will increase from $1,632 in 2024 to $1,676 in 2025. And for the daily coinsurance amount for a hospital stay for Part A, that has increased from $408 to $419 for 2025. And that's after your initial 60 days, which is taken care of by your deductible. But after those first 60 days, you will need to pay $419 per day. Anything after day 61 through 90, meaning your 91st day through your 150th day plus, that has now increased from $816 in 2024 to $838 per day in 2025. In addition, if you need to make use of a skilled nursing facility after your initial 20 days, meaning your 21st day through the 100th day, you can now expect to pay $209.50, which is an increase of $5.50 from 2024, which before this was $204 even. Keep in mind also that if you are 65 or older and you have worked less than 40 quarters or 10 years, you will have to pay a monthly premium for Part A, which is dependent on how many quarters you have worked or your spouse has worked if they are 62. So individuals with at least 30 quarters of coverage or who were married to someone who has the coverage and again is 62 may still buy into Part A at a reduced monthly premium, which will be $285, a $7 increase over 2024. However, if you have not worked at least 30 quarters or have not worked 40 quarters or more, that means that you are on the hook for the full premium amount, which is $518 per month, which is a $13 increase from 2024. Then Part D has a regulated adjustment amount as well, which is based on your income, which again is similar to Part B in terms of IRMA. And that has been in effect since 2011. Now, according to the CMS, approximately 8% of Americans who are using Medicare Part D will pay these amounts, meaning that approximately 92% of Americans fall into the first tier of income brackets, which is $106,000 per year if filing single, $212,000 if filing jointly. And this means that you will pay $0 per month for your Part D plan. But if you are in that 8%, meaning that your income is higher than $106,000 per year filing single or $212,000 filing jointly, you will now have to pay $13.70 in 2025 for Part D coverage. And again, that wild card comes up here again if you are married and living with your spouse but filing separately. And if you fall into this category, you again will not pay anything if your income is lower than $106,000 or at $106,000. However, if you are over that threshold of $106,000, you could expect to at least pay $78.60 for 2025. So now let's take all of these numbers and add them up for a fuller picture, assuming the majority. In a year where you only need one hospital stay, you could expect to pay $3,956 if again you fall inside the base premium income bracket, and if you don't need any immunosuppressive drugs. But if you don't have to go to the hospital at all and everything is fine and in a good year holistically, you will only need to pay $2,220, and that's for the base premium for Part B. However, if things go a little bit awry and you have to go into the hospital twice, you could potentially pay $5,572. But this could be slightly higher if you have to stay inside of the hospital for more than 60 days on that second stint, which then would incur the $419 per day amount, which is your coinsurance. Now, if this video has been helpful so far and you made it this far, consider subscribing because we dive into the data in terms of Medicare and things around insurance on this channel, and this is what this is dedicated for. And for those that have made it this far, leave down in the comments what your favorite movie theater snack is. Mine is popcorn. So this was mainly dollars and cents for original Medicare specifically, and this does not touch anything with an Advantage plan or supplement plan. And to understand how all of that works, included with original Medicare, I made a video that describes all that in detail, and that video is right over there. I'll see you there.